Okay, we've seen the distinct advantages of slit lamp photography, autofluorescence, 11 megapixel imaging, and 3D OCT. How do we make these and many other applications work together? I don't know how you manage all these digital files in your practice, but let's check in with Dr. Ulanski in Chicago and see how connectivity brings all these elements together.
Welcome to the University of Illinois and our presentation today on the use of the ANCA system to improve our clinical operations and operating efficiency. So on my typical day, for example, I would be seeing a patient in the clinic and I'd want to show them their macular hole, I want to show them their tumor, or at least compare it to their previous images. Well, of course, I didn't have the images there in the exam lane, so I would go to the OIS wind station, look to see if they had any imaging performed, and of course, there was no imaging on OIS. So then I'd run to the photo box, see if it was in the photo box, no files, so I'd have to run to photography, ask the photographer to pull the files, we'd have to find the photo file number, find the chart. Of course, if the chart wasn't upstairs, we'd have to go to the bowels of the basement to find it in the storage room, and if we were lucky, we could find it through that whole pile. Now, in the meantime, I have a patient sitting in the office for another 15-20 minutes while I'm running around trying to find these files. And that became a real problem, real hindrance, especially when you do it not just once, 2, 3, maybe even 4 times a day. So I'd like to show you some of the benefits that we found with the ANCA system within our department. First, we have easy access to patient information. When I'm in the exam room with a patient, I can simply type into the computer to a local web address, pull up their photos by name, search for all their reports, including ultrasounds, OCTs, clinical photos, and Goldman visual fields, all within one search with a few clicks of the mouse and a few inputs on the keyboard. And what this allows me to do is very quickly tell a patient or show a patient the results. For example, macular hole. Patient was coming in to see me for a macular hole. I sent them to photography for an OCT, and within 10 minutes, they're back in the exam lane. I can show them the OCT, show them the macular hole, and show them why their vision has been reduced. I think that's the most dramatic example of this. But even it extends farther than that. A patient with a tumor. Immediately, they have questions about what this tumor is. You do an ultrasound, but that's only one image. Many patients come back and they want to see several images. What did it look like 6 months ago? How does it look now? This way, with ANCA, I can pull up the ultrasound that I'm seeing today and pull up the image from 6 months ago and show them direct comparison on how the two images compare. Even transcontinental. We have an adjunct faculty member in California, and one night I had a question about whether a patient may be able to be enrolled in a study, and I was able to pick up the phone, call her in California, and have her pull up the images right on ANCA as I was viewing them in Illinois. So these are the benefits that you can gain from an imaging system such as ANCA, where you can coordinate all your images in one spot. For our department, I know it's been very useful. So in conclusion, I'd like to thank you for coming today, and if you have any concerns or questions about ANCA, I'd always be open to any questions and give you any suggestions that I might. Thank you.
As Dr. Ulanski illustrated, the EyeRoute image management system proved very useful in helping with patient flow, improving efficiency, reducing time in finding and refiling clinical photos, and creating new charts, all of which translate to cost savings. Patients benefit too, because EyeRoute provides easy access to patient information, including ultrasound, OCTs, and clinical photos in one quick search. Patients can immediately see results as you explain a condition, such as a macular hole. EyeRoute can connect data and images from virtually any system or company, such as Topcon, Hogstrite, Zeiss, and OIS, as well as from multiple technologies, including visual fields, OCT, and ultrasound.